Pancreatitis is inflammation of pancreas. Pancreatic inflammation can occur if there is injury to acinar cells or blockage of pancreatic duct. Acute inflammation of pancreas, that is acute pancreatitis, most commonly occurs if a gallstone moves via hepatic duct and blocks the opening of main pancreatic duct. This will increase pressure in the pancreatic duct and will lead to accumulation of enzymes in duct and acini. So these enzymes won't be able to enter duodenum and will accumulate in the ducts and acini. Direct injury to acinar cells can occur due to a bout of excessive alcohol and in certain viral infection like in mumps. In both the causes, there is activation of trypsinogen to trypsin within duct and acinar cells. Since trypsin is a proteolytic enzyme, it digests the pancreatic tissue itself. Plus, lipase starts digesting the fat. So because of this tissue injury, there are many morphological features. The digestion of the pancreas by trypsin leads to red-black hemorrhagic areas. And because of lipase, we see areas of yellow-white fat necrosis. These enzymes also injure the wall of the blood vessels, causing leakage of fluid within the pancreatic tissue and leading to pancreatic edema. This appears as swelling of the pancreas. The pancreatic enzymes, amylase and lipase, also enter into blood vessels. These enzymes have a toxic effect on other organs and cause leakage of fluid from blood vessels all over the body. The destruction of the pancreas can range from mild to severe. So morphologically, in mild pancreatitis, there is mild edema of the pancreas along with some areas of fat necrosis. In mild forms, blood vessels are intact, so blood supply to the pancreas is maintained. In more severe forms, due to lot of tissue damage, red-black hemorrhagic areas are seen, interspersed with yellow-white fat necrosis. In very severe forms, there is extensive necrosis throughout the pancreas and diffuse hemorrhages are seen throughout the body of the pancreas. So if we look into clinical features of acute pancreatitis, there will be acute abdominal pain because of lot of tissue injury. Then, due to extensive leakage of fluid from the blood vessels, the patient can land into shock. The investigations will show increased amylase and lipase in serum since they have entered into the blood vessels. Plus, all these morphological areas can be visualized by scans like CT, MRI, and MRCP. Chronic pancreatitis, that is long-standing pancreatitis, can also occur due to similar causes as that of acute pancreatitis. But here, the cause will be long-standing. So long-standing obstruction of the pancreatic duct by gallstones and chronic alcoholism can cause direct acinar injury. Plus, if there is decreased secretion of bicarbonate and watery secretions from the duct cells, as occurs in cystic fibrosis, will prevent washout of the pancreatic enzymes and lead to accumulation within the duct and acinar cells. That can also lead to chronic pancreatitis. But in chronic pancreatitis, morphology of pancreas will be different. Whenever there is long-standing inflammation and destruction of tissue, there is release of various growth factors by WBCs which have infiltrated the site of inflammation. So because of these growth factors, there is a lot of healing and scar formation at the site of tissue injury. And excessive scar formation leads to fibrosis. Long-standing tissue injury also leads to decrease in number and size of acini. So there will be kind of pancreatic atrophy. Plus, because of this so long obstruction of the ducts, there will be dilatation of the pancreatic ducts. Since there is back pressure which is continuously accumulating, it will lead to dilatation. Not only the exocrine part of the pancreas, but endocrine part of the pancreas can also be affected, causing decrease in the number of islets of Langerhans. So because of these pathophysiological changes, the clinical features will be chronic abdominal pain due to persistent tissue injury. Then, due to decrease in number of acini, there will be decrease in pancreatic enzyme secretion. And since these are essential for digestion and absorption of nutrients, there will be chronic maldigestion. So the person will have a lot of weight loss. Then there will be steatorrhea, that is appearance of fatty stools then because these nutrients are remaining undigested, there will be osmotic pull of water. There will be chronic diarrhea. Then since islands of Langerhans can also be affected, it can lead to hypoglycemia since the amount of insulin released in the circulation will decrease. So there may be features of hypoglycemia, diabetes mellitus. Then it may also be accompanied by jaundice since there is obstruction of the main duct. So there will be cholestasis. The bilirubin won't be excreted in the intestine. So these features may be accompanied by jaundice. In investigations, we can find fat in stools due to steatorrhea. There will be hypoglycemia, right? Bilirubin may be increased. Then all these morphological features can be visualized by scans like CT, MRI and MRCP. But amylase and lipase levels will not be increased in circulation as was occurring in acute pancreatitis because acini have been slowly destroyed and these are the ones which have been synthesizing these enzymes. So less number of acini, these enzymes will not be formed and can't be released into circulation. So in chronic pancreatitis, there won't be increase in amylase and lipase in circulation.